Well, good morning, everyone. And once again, welcome to another live this morning. We love having you on. And yep, it's Q&A Friday, so it's always a lot of fun. Okay? So we got questions. Hey, let's see who's going to say hello to us first this morning. First on the hit parade, Brahim. On my chart, Brahim, you're numero uno. Portland, Oregon. Lucille's on, and Andrea, and Lynn from Aurora, and Bonnie from Blenheim. Lisa, good morning to you. Kevin, partly sunny Oshawa. Yeah, well, we're not going to see the sun here, but we had a great week. Rosa Linda, Nellie, Laurie, Cambridge, Ontario. Nativity's on with us this morning. And Brahim's telling me he loves me. Well, I love you too, Brahim. Sandy, Fergus Falls, Minnesota. Rosa's on with us from La Belle Ville de Montréal. Berishan, how are you? Anna, Sharon from good old Kansas. Carol is on from West Virginia. Maria from Ottawa. Helga and Dave from Scarborough. Karen, good morning. Georgie, there she is from Halifax, Nova Scotia. Marl is on this morning. How are you? Judy, in disguise from New Brunswick. How are you, Judy? Danny Lee. John, our friend from Elgin, Illinois. Vashti, Elaine, Dennis, Fran. There's Fran. I was waiting on you. Norma, Texas. Frida, Devlin. Guys, it's like I know you personally, right? For years. Hi, Patricia. And Gwen from sunny Alberta. Helga, saying good morning to Mary. Joan, Blind River. I'm going to say hi to Doc McEwen. I never see her name. Once a week, maybe. Sandy, how are you? Marilyn, April from Oshawa. Phyllis from West Tennessee. I love West Tennessee. And Patricia and Chaz, how are you? Rhoda, Labrador. Lisa Marie. Okay. Amber, New Jersey, good morning. Thanks for coming on. Shelley from Alberta. Eileen from Brampton. And Gail from Mount Pearl. How is you? Sue, Manitoulin Island. Oh, it's a beautiful place. Judy, Newfoundland, and Dave is on. A dear, dear friend from Muskoka. Carol, Mount Pearl, Newfoundland. Judy, Brian, how are you? From Falconbridge. That's right. Next door, Catherine, Cheryl, Lighthouse Cove. Okay. Heather is on from Miramichi. I hate to miss anyone. Hi, Francis. And Beverly from Stephenville, Newfoundland. And Rose and Karen. They're coming by, guys. And Milica. Okay, Marissa, the first one this morning. Dr. Martin Cupping. Okay? Is it good or bad for you? Well, I can't see how it could be bad for you. Okay? Look, when I graduated, there was no such thing as cupping. Okay? And now practitioners use it, massage therapists use it. I'd have to ask a few chiropractors if they use it, but I know massage therapists do. And I sort of understand why they do it, what benefits they get. You know, people that have had it done maybe here on the scroll, you guys comment on that. Like for me, I've had no personal experience with it. And I know my patients did. How much were they talking about it? what are the real benefits of cupping? I'm going to leave it to the scroll because, like I said, it's certainly not bad for you. How much good it does? Hey, any massage therapists on there that on with us this morning that would comment on that? Give us a better answer than I'll give you. Laurie, what does Dr. Martin think of smokers for smoking meat? I love them. Okay? Like, you're going to read all sorts of stuff. Don't smoke meat. Don't barbecue meat. It's all bad. Nah, I don't believe it. I'm pretty hard-headed. I think you guys know that. But I'm not convinced. There's a war on meat, especially red meat, especially steak. There's a war on it. And so they'll come up with anything. There's a war, guys, on bacon. Like, it's smoked. Yeah, it makes it taste better. I love smoked bacon. I love smoked meat. Is it bad for you? Well, what do you think they did 100 years ago? It's good for you. It's not killing any of the vitamins, any of the amount of protein and amino acids that you're getting. It's good for you. Enjoy. Cook it the way you like. And, don't, like barbecue, that's bad. Who said that's bad for you? Man, is there anything better than a barbecued steak? Or in a smoker? It's so good. Like I said, guys, there's so much of a war going on. If you understand that, then you go, yeah, I know where that's coming from. Okay? I can tell you, let me just say that. Give me a piece of steak smoked or barbecued, and it's better than any vegetable that you can name me, including broccoli. And broccoli's good for you. Avocados are good for you. They're good. But they don't have the nutritional profile that a steak has. Okay? So, understand that. Well, but you barbecued your steak. Well, so what? It's still good for you. You didn't kill off the vitamins. You didn't kill off the protein in the steak. What are you going to do? Eat it raw? There's propaganda, guys, and I don't buy it. So smoke your meat, barbecue it, whatever you like to it. Her husband is thinking of buying a smoker. Go for it. Enjoy. Alice, what is the best way to treat a bruise? Well, it's superficial, right? It's the blood vessels, those superficial blood vessels that get damaged there, okay? Now, if you have bruising all over the place, and that can be a sign of, a disorder, that's a different puppy altogether, like a leukemia or whatever. We're not talking about that, but you get a bad bone bruise, and it's the superficial blood vessels that are like, from a standpoint of a supplement, the best one would be Navitol, in my opinion, because it elevates your nitric oxide. But That's what I would say. Okay. That was Alice. Roxanne. I take a tablespoon of flaxseed daily for estrogen dominance. You're a smart girl. Okay? You're a smart girl. So can you take more of it? Yeah, you could certainly take a couple of tablespoons if you want to up it. The menopausal formula that we have is a dimmer. It blocks extra estrogen. It doesn't block all your estrogen. Ladies, you're never going to block all your estrogen. But what I like about the menopausal formula, it dims out your extra estrogen, and that's a big problem in our society today. And so do flax seeds. And the menopausal formula elevates your progesterone. That's why the formula. Okay. Okay, hold on a minute here because I want to answer another question about this. Here it is. It's Laura. I know Dr. Martin wants us to block estrogen. Yep, extra estrogen. I do that by taking the menopausal formula daily, okay? I am postmenopause and have a lot of dryness to all my mucosa inside my nose, under the eye area, fingertips, and privates. Everything you read online is due to decline in estrogen. Well, it's not as simple as that, okay? Yes, for sure, Laura, your estrogen is going down. There's no doubt about that. But what's really important is the balance between estrogen and progesterone. And when you don't have enough progesterone, your estrogen is dominant, even though you have all the symptoms of dryness. Okay? Of dryness. What I don't like is adding estrogen to the mix. You can't make me do it. I know out there, somebody asked me last night. Okay? Somebody asked me last night about the biggest craze for women is taking estrogen. I don't recommend it. Why do we see so much cancer today? Breast cancer, ovarian cancer, prostate cancer in men. Why? Why? Why is it worse than ever? I'll tell you why. It's estrogen dominance. And it has to do with the imbalance between estrogen and progesterone. I do not recommend estrogen. I never have. I don't like it, even a bioidentical. I don't like it. I didn't use estrogen. But progesterone, ladies, is really good for you. And even in dryness, it's progesterone that needs to be elevated in order to balance out that estrogen. Okay, that's where I come from. Okay? So, I knew there was another one there. And Roxanne and Laura. Okay. Carol Ann's asking, what progesterone cream would Dr. Martin recommend? If you're going to use progesterone, it's a bioidentical. Okay? There's wild yam. You can use a wild yam cream, but that's not a bioidentical. Bioidentical, I used to give you that. Okay? When I was in practice. I can't do it anymore. I'm not in practice. But I like bioidentical progesterone. Okay? And it's bioidentical. It's not synthetic. It's exactly mimics what your body makes. Okay? From a supplement, like you can get a wild yam without a prescription. And I think even in the States you can get some bioidentical hormone, but make sure it's bioidentical and not synthetic. Thank you very much, Carol Ann. Thomas, I read an article that states, ooh, Thomas, you're going to give me a migraine. I'm getting a migraine. What? I read an article that states you should not drink hot liquids. Thomas, what were you reading? Nothing hot. I never heard anything, Thomas, as stupid in my life as that. You can't, you got to have your coffee cold? Are you kidding me? And Thomas, I know you read the article, so it's not you. You knew, Thomas, you would give me a migraine, didn't you? You got to have soup and it's got to be cold? Are you kidding me? What guru, what idiot said that? Thomas, please send me the article so that I can have a double migraine. Unbelievable. Are you kidding me? Why? Something about burning your throat. Not good for your stomach. That's crazy. They don't know what they're talking about. Esophageal cancer is because it's hot. You're kidding me. Somebody's asking, what should my progesterone numbers be? Who cares? Who cares? You got to look at every hormone, and who cares about the numbers? Because what are your symptoms? The numbers. Look, I used to do all the testing, but I didn't rely on testing. Okay. Thomas, you really got me going this morning. Okay, he's got a second part to his question. Okay. My blood pressure's coming down, Thomas. Okay? It's coming down. I'm calm. I can't help myself. Okay. Also, if you are eating eggs, meat, and cheese, smart, and eliminating sugars, smart, can cancer cells die off knowing they live off sugar and hate steak? Yep. Listen, Thomas, as you know, as I speak, you and I are fighting cancer. You fight it every day. Cancer cells raise their ugly heads every day, and you have to fight it. And that's the war on cancer, which the world is losing, but you can win. Okay? The world's losing the war on cancer. We have more cancer than ever before. We did a couple of podcasts this week on that. Okay? Cancer and the cancer industry. And we're losing. We spend more money in North America than anywhere else in the world, and we got the worst cancer rates than anywhere else in the world. Why? Okay? So we're not winning the war. But you, Thomas, need to win the war. I need to win the war. And the war that you can win is you make yourself, you make your immune system a fighting machine. And your immune system is comprised of different things. Your gut, Okay, we talk about the blood-gut barrier. We talk about your T cells, which are your Navy SEALs of your immune system, and they don't work without vitamin D. And plus, your T cells are put to sleep by sugar. They have a siesta when you feed them sugar. So no sugar and eat steak and vitamin D. The sun, steak, and steel. Have you ever heard of that before? The book? Okay, that was Thomas. And Thomas, we had fun this morning, didn't you? You knew, Thomas, that you were going to get me going, didn't you? I think some of you guys do it on purpose. Okay, I think these are two questions that are very much related. What does Dr. Martin think, this is Bev, of cortisone shots in the shoulder? Okay? Well, one of the problems with shoulders and hips, okay? You got a bad shoulder, frozen shoulder. I used to see that a lot in practice. Lift your shoulder. Lift your arm. Had trouble doing it, right? Frozen. One of the reasons that happens, okay, post-injury, is there's no blood in the shoulder. It's called an means none, vascular, avascular joint. And guess what? Your hip is an avascular joint too. So your hips and your shoulders, they don't have a lot of blood supply. That makes them very hard to get better. Okay? Shoulders and hips. Very hard. So one of the treatments that doctors like to use is cortisone. And cortisone, okay, and prednisone, they're steroids. And they're anti-inflammatory with a big B-U-T attached to them. A big butt. Okay? So it's not like you're injecting cortisone into the butt. You're injecting cortisone into the shoulder. Okay? But there's a big butt involved. What is that? Side effects. The problem with cortisone, it is a tremendous anti-inflammatory. There's no doubt about it. But it destroys tendons. And you got to weigh the risk of getting a cortisone shot, in your knee or whatever, because it causes damage and can destroy tendons. Okay, because I think this is what, hold on. Who is asking? Rita. Because she's asking a question. And I think, Rita, unless I'm mistaken, is there such a thing as cortisol poisoning? I don't think you meant that. Okay? As stated by the University of California, the university says cortisol destroys hip tendons. Well, not cortisol. Cortisone. That's different. Okay? Cortisone destroys hip tendons. So, did they call that a cortisone poisoning? Not cortisol? Because cortisol, you make cortisol every day. It's part of your circadian rhythm. Cortisol wakes you up in the morning. Cortisol elevates your blood sugar to get you going. The problem with cortisol is when it doesn't get turned off. But I don't think you're talking about that, Rita. I think you're talking about the injections of cortisone, right? I think. Yeah, because you're experiencing peroneal tendonitis. Walking is painful. Yeah. Ankle and calf. No fun under the sun. So you're talking more of cortisone, not cortisol. Rita, let me know if I'm misquoting you, because I think that's what you're talking about. Okay? Look, the way I like, for example, okay, let's get back to Beth. Look, you got to weigh whether you want whether you want a cortisone shot or not. Okay, because sometimes it can be pretty dramatic. I've seen it where it really made a difference. Okay, but remember what it does. Okay, comes with a boatload of side effects. So you got to be very, very careful with it. Okay, and I know these athletes, for example, they get, because they've got to make a living, and they get these cortisone shots. But I tell you, their future, they often are very crippled up after their career. Okay? I used to see it in a lot of football players, and their tendons are done like dinner. Anyway, okay? So I love, in a natural form, I love curcumin. I love Nabitol combined together. Very anti-inflammatory. Okay? That's what I love. Okay. Joanne, I know Splenda is a sugar substitute. Yep. But is Splenda the same as sugar? No. But it's bad. It's not the same as sugar. Okay? Got no calories. And the problem with Splenda, okay, these sugar substitutes, what they're finding out, and what we didn't know when they first came out, but if you, I've been around a long time, so I watched these things come out, okay? And, and people drinking diet sodas, and like, they're so popular, okay? And here's the problem. Still stimulate insulin because of the sweetness factor. And secondly, even though there's no calories in it. And the biggest thing is it affects your microbiome. It changes the gut bacteria. And we didn't know that when they first came out, but we know it now. Okay? So if I was you, avoid like the plague. Okay. Sandra, I think, is asking. Yep. Sandra, what would you recommend for essential tremor? Okay, so this is isolated. It's usually runs in the family, essential tremor, and it doesn't seem to be bothering you, right, Sandra? Yeah, just a minor tremor. What would I do? Well, anything nerve related, I always was a big guy on, and you could try this to see if it gets better. I liked B12 because it's a nerve vitamin. So anything have to do with nerves, I'm very big on B12, and I combined it with Nabitol. Again, the pine bark, okay? Elevates nitric oxide, blood supply, nerve supply, and B12. I put them together with neuropathy, with essential tremors, and I got pretty good results. And you know what? If it doesn't work, here's a rule of thumb, not that it's going to hurt you, but if it doesn't work with your essential tremor within 30 to 60 days, Sandra, not going to work after that. Okay? If you take it only for that. It's good for you to take anyway. I take B12 every day. I take Nabitol every day. Deborah. Deborah had open heart surgery, and she's got a keloid scar right down the middle of the chest, the breastbone there, the sternum, right over top of it. I tried a lot of creams, didn't help, and it's bothering her. Okay, I think so. Sensitive and red. Let me give you a little thing you might try. Okay, you probably have tried the Rivera. You know what? I get a little bit, I'm a big guy on oil of oregano. Okay, because if it's still bothering you and it's sensitive and it's hurting, there's maybe a little bit of fungus that's sitting in that scar. Okay. I like oil of oregano, so just take a dab, use a pad, a little, like a makeup pad or whatever. Put a little couple of drops of oil of oregano on it, maybe some Rivera, and put it right over the scar, Deb. Try that. Okay, Gail. Hey, guys, we're going to get done this morning. I've been told that I have CFS, chronic fatigue syndrome. Is there anything that can be done about this? Well, Gail, you came to the right place, because I'm going to turn to my right here and grab a book. Here it is. I could grab a lot of books. Here it is. And I have a picture of another book that I wrote on chronic fatigue, the syndrome. Okay? See that guy back there? Who is that? It's me, chronic fatigue syndrome. I wrote many a book in French and in English. Okay. I specialized in chronic fatigue syndrome. Okay. And I did a lot of research because my wife had it. And I did the deepest dive that you could have. I actually wrote, let me show you one more thing. This is my thesis that I wrote on chronic fatigue syndrome. And then it turned into a book. But this is the original thesis that I wrote on chronic fatigue. So Gail, yep, okay, there's definitely help. When you realize what it is, it's adrenal gland, adrenal on top of kidneys, exhaustion. It's not just a fatigue. There's 4 major symptoms of chronic fatigue syndrome. Obviously the fatigue. Brain fog. They used to explain it like it was cotton in the brain. No fun. Fibromyalgia. Medicine likes to separate fibromyalgia and chronic fatigue syndrome. I never did. I just said it's a double-edged, double-sided coin. Fibro goes along with CFS. You get a sleep disorder. Even though you're exhausted, you don't get into the recuperative sleep, which is very important. So, is there help? Yes. Is it easy? No. One of the reasons, okay, and I always did this with CFS. I did it in my office with a lot of things. But I would get out the pyramid. I would teach from the pyramid. Okay? Thyroid is involved in CFS. It slows to a crawl. Adrenals are the major cause. They're exhausted. Okay? They're exhausted. What does that do? Well, that robs your progesterone. It causes estrogen to become dominant. It elevates your insulin from the pancreas and insulin resistance. So you have to change your diet. Sugar destroys your adrenals. Off the sugar. You need eggs, meat, and cheese. You do the 30-day reset. You want to balance out. You want to be on the cortisol formula. Okay? You want to dim out that estrogen because your thyroid's going to be affected by that. And I would have you on because you're into such a storm. We call chronic fatigue a category 5 storm of all of this getting messed up. Okay? So, short answer, there's help for sure. Okay? Thank you for the question. Okay, let's see. That was Gail. The doctor said there's nothing to be done. Yeah, from a medical standpoint, there's nothing that they can do. The doctor is right. Now, he should have said, go see Dr. Martin. Of course, I'm not in practice anymore. Okay. Okay, Mo. A year ago, I started supplements. Vitamin D, smart. B12, smart. Navital, smart. DHA, smart. Magnesium, smart. To help me reduce nerve pain all over my body. After a year, I noticed my kidney functions are declining for no specific reason. Well, that's not true, Mo. That's not true. And first of all, it ain't, for emphasis, your supplements. Okay? Anybody ever tell you that? Run, Forrest, run, because it ain't true. DHA is only good for your kidneys. Magnesium is only good for your kidneys. B12 is only good for your kidneys. Navital is only good for your kidneys. Is there anything else you were taking? No. Okay, vitamin D is only good for your kidneys. So it's not your supplements. Mo, look, kidneys, Niagara Falls, they're starting to decline in terms of their function, probably more food. And, you might not know, Mo, listen, I don't know you. I haven't got your blood work, but I wouldn't be looking at supplements. I'd be looking at your A1C. I'd be looking at your triglycerides. I'd be looking at your HDL. Why? Why would I do that? Well, because kidney function is very much related to sugar and your blood sugar and insulin. And you might think there's no specific reason. Now, Mo, what are your numbers? Okay? Like, what's your GFR? Our glomerular, GFR, yeah. What's your albumin? You're giving me declining for no specific reason. There's a reason. It's just a reason that you don't know of yet. But there's a reason. Are your doctors concerned about your numbers? Okay? Or just you? I'd like to know that. Okay? Send me more info. info@martinclinic.com. It'll get to me. Because I can't answer your question without knowing what's going on. Okay. But I'm telling you, it ain't the supplements. I got tens of thousands. No, I got 1 million people. Am I exaggerating? Not much. Close to it. Take the supplements you take. And it actually helps their kidneys. Okay? And you'll get a doctor, vitamin D, you can destroy your kidney. That is a bunch of bunk. Okay, one more and then we're done. Sylvette, the winter we found mold in my house. No fun. Get rid of it. Do everything you can. Mold is very toxic. Sugar's toxic and mold is toxic. And by the way, in chronic fatigue, that's often an issue. Exposed to mold. Often. Okay? We saw that. I wrote about it. Okay? Allergies through the roof. And now she can't stand perfume, dust, chemicals, allergens, hypersensitivity. Yep. What are the big rocks? I like that, the way you say that, Sinbad. What are the big rocks I should focus on? I love that. Rocks. Like what you should focus on. Focus on your gut. Numero uno. Probiotics. Regenerate, replenish, renew your microbiome. That has been affected big time. A big part of your autoimmune, and that's what your hypersensitive is, just auto. Auto means your body is turned on itself, and you're hypersensitive. Okay? I would have you on probiotics, diet, lay off the sugars, don't feed the bears. You probably have a fungal, low-grade yeast or fungal infection inside your blood. Get rid of it and don't feed the bears. Okay? I'd have you on a combination of Navitol and quercetin, very antihistamine. What else was I going to say? Vitamin D, check your D levels. Check your B12 levels. Better get on those. Thank you, Sidet. Good questions today, guys. Thank you for all of your feedback. Thank you. Share this, okay? And Thomas, I'm feeling a little guilty because I sort of went after Thomas today. But I did it, Thomas, to more tease you, okay? When you gave me that, I just couldn't help myself. Okay, no hot drinks. Who in the world would say that? I love you guys. Talk to you soon.